We start a Better Memphis today with a story out of Mississippi that's having a major impact right here in Memphis. Recently, Governor Tate Reeves of Mississippi vetoed a bill that would have allowed Le Bonheur Children's Hospital to be a part of a statewide Medicaid funding program. The hospital is the only level 1 pediatric trauma center other than UMMC designated by the Mississippi Trauma System. Le Bonheur has participated in this program since 2022, but that is now changing, and we're here to talk about that. Joining me today to talk about the impact of this change is Le Bonheur CEO Dr. Trey Eubanks and Chris Beeman of Hernando, Mississippi, whose son was treated at Le Bonheur. Welcome, gentlemen, to both of you. Thank you very much for being here.
Thanks for having us.
So, Dr. Eubanks, let's start with you. Le Bonheur is the second largest provider of care for Mississippi children. First, tell us what that means for Le Bonheur to be in the Medicaid funding program.
Well, obviously, we take care of all kids that show up at our door, and our primary service area is West Tennessee, North Mississippi, and Eastern Arkansas. We take patients from all across the state of Mississippi, in fact, partnering with UMMC to do so. We saw last year about 18,000 Mississippi Medicaid patients from almost every county in the state, even from the coast. Some 12 patients from Harrison County, which is where Gulfport is, came to us for care. And the reason they did was because we can provide services they can't get in their region.
And it's in the thousands and in the numbers of Medicaid children who come from DeSoto County, north of 6,000.
Yeah, over 6,000, that's right.
All right. So how will this veto that the governor made impact Le Bonheur and Mississippi families? Can they still be treated at Le Bonheur?
Yeah, the kids will still be treated, and we'll still take care of them. The impact is a financial impact on the hospital. Last year when this bill came up, we'd been in the program until the previous year. We were not able to get out of the legislature. This year, the House and the Senate both passed the bill pretty overwhelmingly, but unfortunately the governor did not agree with some of the context of the bill, and it was vetoed.
All right, let's talk to you, sir. Chris, your son was treated at Le Bonheur. So tell us how this veto is going to impact his treatment going forward.
Well, I think as Dr. Eubanks has talked about, the fact that they may have to make some tough financial decisions, how will that impact the care that ultimately my son and others like my son will be able to receive in the future? Will the standard of care be the same? Will the accessibility to care be the same? All of those things are a little bit unsettling and could definitely have an impact on my family and many others throughout the state of Mississippi.
We're sharing some images that you shared with us. Yes. of your boy named Will, who underwent a transplant as a baby, right? Yes,
at 6 months old, he had to have a liver transplant. My son's story couldn't be told without Le Bonheur. He was, during my wife's pregnancy, we knew that he was going to be born with a condition called clubfoot, which is actually pretty cosmetic and actually affects how you walk. But then it was at 2 months old that he was diagnosed at Le Bonheur to have a rare liver disease, that biliary atresia, that affects about 1 in 20,000 babies. And ultimately, a high percentage of those folks need to have liver transplants, which Will did, and ultimately Le Bonheur helped us get through that process.
All right, so the hospital just, Dr. Eubanks, performed a heart transplant on a young patient from Jackson, Mississippi. How is that family going to be impacted going forward?
Well, I think it's similar. I mean, we want to provide outstanding care. We want Mississippians, Arkansans, West Tennesseans not to have to go anywhere to get the best care that they can in the country. And we feel like, as a top children's hospital, according to U.S. News, we provide outstanding care for them. Any child that comes to us, we're going to take care of. However, as a partner in the state of Mississippi, we would like Mississippi to help us in that partnership to continue to provide that outstanding care. And this child that had the heart transplant from Jackson could get the care that they needed, so they came to us and we were glad to provide it.
All right, so the hospital is asking Mississippians to speak up now. And so, Chris, you and your neighbors and parents of other children and grandparents of other children, you're being asked to send a message to the legislature to maybe try to override the governor's veto or convince him to change his mind about this. So what's the message, both of you?
I think from my perspective, this bill and this legislation has far-reaching effects. It's not just the Medicaid patients, it's all children in Mississippi. And the impact on lives, at the time most vulnerable for those families, the last thing that they want to have to think about is where they're going to be able to go, and will they be able to access care. And so, you know, it's not just a line item in a bill. These are lives at stake, and that's what I would implore the legislator and governor to consider.
Absolutely. And for me, I just think that the constituents need to reach out to the legislators, their senators, their House members, the governor, the lieutenant governor, and let them know how important Le Bonheur Children's Hospital is to the health of their kids.
Because this is the capital of healthcare in North Mississippi. There's just no question about it. Mississippians come here all the time and I've covered so many stories about this very issue, about Mississippians receiving treatment at Regional 1 under its many names over the years, going all the way back to John Gaston. And this has come up time and time again, but the Medicaid dollars were there, which are federal.
That's right.
And that's the problem here, that's not going to be available with the governor's veto.
That's right. And so what we would ask is that if you know a House member or Senate member, if you don't know, get to know them and let them know how important this is so they can influence the decision making at the Capitol.
All right, thank you so very much, both of you, for being here. For A Better Memphis, this is something we know both of you work for every day. A Better Hernando, too. I was just down through your town today. I got to speak to the graduates at Senatobia High School this morning at their senior breakfast. And so we do want to mention that we did reach out to Governor Tate Reeves' office for a comment about this very story, about this interview. We let him know we're doing this. We have not heard a statement from the governor or his office since we asked for one today.